It's the start of another day for little Zoey Jones. Another day of beating the odds. Zoey was born with severe internal complications. Her doctors thought she may not even live to see her first birthday.
Her esophagus wasn't connected. Her stomach and her small intestine were not connected. On top of her heart condition, which was worse than what they thought when we were pregnant.
Zoey's heart wasn't pumping enough blood to her lungs. Just 90 days into her fragile life, she had her first life-saving surgery.
She's had a very long road. We've had 13 surgeries, 3 open heart surgeries. We've had 7 cardiac arrests, and we've had 5 strokes. So she spent more than half of her life in the hospital.
Eventually, doctors in Zoey's hometown of Nashville decided her best hope was a heart-lung transplant, a very rare procedure.
The hospital here said that there was nothing else they could do for her. Her heart function had gotten so bad, and her lungs were not functioning very well either.
Looking for any chance of hope, Zoey and her mom flew to Nationwide Children's Hospital. There, Dr. Darren Berman made a remarkable discovery during a routine procedure.
We determined that she actually had too much blood flow to her lung arteries. That's where the procedure got very interesting. We found that if we temporarily blocked some of the flow from one of her prior operations, that the pressure in her lung arteries actually came down to a very safe level.
At that point, he's like, okay, her lungs are actually working really well. We don't need a lung transplant. Now let's look and see if we need the heart transplant or if there's something we can do different.
It turns out there was. Dr. Berman plugged off the excessive blood flow to Zoey's lungs in the cath lab. After recovering from the catheterization, she underwent another heart surgery to redirect blood flow to her lungs, a procedure known as a Glenn operation. And that's when everything changed.
It went amazing. It went better than, even the doctors expected.
Zoey was expected to spend 8 weeks in the hospital recovering. She was home in 10 days.
She has learned how to walk by herself, and doctors told us she would never walk, and she's walking unassisted now. She's actually cognitively at a 3-year-old level, which is amazing considering she's had so much time in the hospital.
Finding something like this is extraordinarily rare, and being able to help her in the way that we did really, I think, altered her life course. If things are as good as I'm hoping they are when we catheterize her in the next few weeks, heart transplant may not be part of her future.
It was a godsend for us. It really was. That was the surgery that she needed.
Zoey's mom says she always knew her daughter would be an inspiration, which is why she named her Zoey.
It's Greek, it means life, and she is full of life, so it's a very appropriate name for her.
At Nationwide Children's Hospital, this is Nikki Chave reporting.